How does Cushing's disease relate to diabetes in dogs? Have you ever wondered how two seemingly different health issues in dogs can be connected? Today, we are going to explore how Cushing's disease relates to diabetes mellitus in dogs. Cushing's disease, also known as hyperadrenocorticism, is a condition where dogs produce too much cortisol, a hormone made by the adrenal glands. This excess cortisol can significantly affect how the body processes glucose, which is sugar. Cortisol plays a role in raising blood sugar levels. It does this by promoting gluconeogenesis, which is the creation of glucose from non-carbohydrate sources. At the same time, cortisol reduces the effectiveness of insulin, the hormone that helps cells absorb glucose from the bloodstream. When cortisol levels are too high, as seen in Cushing's disease, it can lead to insulin resistance. This means that the body's cells do not respond well to insulin, resulting in higher blood sugar levels. In many cases, diabetes mellitus in dogs can develop as a secondary condition to Cushing's disease. The ongoing excess of cortisol can overwhelm the pancreas, making it difficult for this organ to produce enough insulin. As a result, dogs may experience persistent high blood sugar, known as hyperglycemia. This type of diabetes can be more challenging to manage because it is essential to address the underlying hormonal imbalance to control the diabetes effectively. Dogs with both Cushing's disease and diabetes often show similar symptoms. You may notice increased thirst, frequent urination, increased appetite, and weight loss despite eating well. Managing these conditions requires careful attention to cortisol levels, which can help improve insulin sensitivity and regulate blood sugar levels. Treatments for Cushing's disease may include medications that reduce cortisol production or even surgery to remove a tumor that causes the excess hormone. Successfully treating Cushing's disease can lead to significant improvements in diabetes management, and in some cases, it may even resolve the diabetic condition altogether. However, having both Cushing's disease and diabetes mellitus can worsen the overall prognosis for dogs. The combined effects of these conditions can shorten life expectancy if not managed properly. Early diagnosis and integrated treatment targeting both diseases are vital to improving the quality of life for affected dogs. In summary, Cushing's disease contributes to the development of diabetes mellitus in dogs by causing excess cortisol production, which leads to insulin resistance and disrupts glucose metabolism. Effective treatment of Cushing's disease is essential in managing diabetes in affected dogs, often improving or resolving the diabetic condition.